The late Professor Stephen Hawking may have been misdiagnosed, and was actually a victim of polio, a medical expert has claimed. Dr. Christopher Cooper, a physician at the University of California, thinks the famed physicist's symptoms don't align with those of amyotrophic lateral sclerosis, ALS, often referred to as motor neuron disease, MND, in the UK. Hawking was diagnosed with the degenerative condition aged 21 and given 2 years to live, yet he survived the illness for 55 years. Dr. Cooper claims the probability Hawking had ALS is low, because his age at onset and prolonged survival do not match our understanding of the disease. Pointing to 2 outbreaks of polio in the UK and the US that occurred in 1916 and 1952, he suggests polio as a potential cause for the scientist's condition. In a letter to the Financial Times, Dr. Cooper says the physicist's neurological and motor system impairment could have been caused when he contracted polio shortly before he was diagnosed with ALS in 1963. He says degeneration of the physicist's brain only affected the motor system, leading to weakness of peripheral muscles, symptoms typically seen in polio sufferers. Hawking, who died last Wednesday aged 76, was famous for his dependence on a wheelchair for movement and a computerized voice system for communications. His long illness and early diagnosis confounded doctors. The average ALS sufferer is diagnosed after 40 and rarely survives longer than 20 years. ALS is a subset of the motor neuron disease umbrella that makes up nearly 90% of MND diagnoses, meaning the 2 terms are often used interchangeably. The degenerative disease results in the loss of nervous tissue from the muscles, leading to progressive muscle paralysis and wasting and, ultimately, death. In his letter, Dr. Cooper outlined a number of anomalies regarding the condition of the great physicist. He wrote, "The affliction that Hawking suffered began when he was only 21 years old and his illness lasted 55 years. The age of onset and the clinical course do not match our understanding of ALS. The probability that Hawking had what we commonly call ALS is low." The University of California professor emeritus said, he does not doubt the severity of Hawking's neuromuscular disease, but indicated that it may not have been ALS. Pointing to 2 outbreaks of the poliomyelitis virus in the UK and the US that occurred in 1916 and 1952, Dr. Cooper suggests polio as a potential cause. Dr. Cooper adds, perhaps Hawking was unlucky to contract poliomyelitis, or a similar viral infection a few years later in 1963. After 1952, effective vaccines were developed which helped prevent the spread of the lethal disease. Despite this, large outbreaks continued throughout the world into the 1980s. Since 1988, a global vaccination campaign was implemented. Since then the world has made rapid progress against the disease, and until 2016 the number of paralytic cases was reduced by 99.99%. In 2016, there were only 42 cases worldwide compared to 350,000 per year in the 1980s. Whilst it would have been unfortunate for Professor Hawking to contract the human-to-human disease, it is not unreasonable to suggest. Dr. Cooper assumes in his theory that the neurological problem only affected the motor system, leading to weakness of peripheral muscles. Whilst the speculation over his illness continues to circle, the nation continues to mourn the loss of one of the most brilliant and inspiring minds of the past century. Just prior to his passing, the famed theoretical physicist, at the age of 76, finished his theory on the multiverse. A grand theory, complete with complex equations, that hypothesized the existence of multiple universes stemming from multiple Big Bangs. The existence of multiple Big Bangs was a troubling implication of his 1983 no-boundary theory. The longtime Cambridge professor will leave a legacy behind of how one man's mind can tackle the most complicated and advanced issues of our era whilst simultaneously fighting his own personal battle against physical disability. Although prevention has improved markedly in the last half a decade or so, there is still no treatment for polio. Those unfortunate enough to contract the illness are likely doomed. Much is the same for motor neuron disease, with an average life expectancy after diagnosis of 2 to 3 years. Only 20% of ALS patients live longer than 10 years. Experts have become more adept at diagnosing the disease, but the cause of the condition remains unknown. Professor Hawking made his name, and his impact in a theoretical field where pre-existing knowledge on the matter is minimal. However, it seems just as little is known about the cause and treatment of both polio and motor neurone disease. As Dr. Cooper surmises, Hawking was a remarkable man whose existence shone a light on both of these mysteries.